The first session is on mental health and prevention. Speakers in the first session are Dr. Irena Đorđević, Clinic Dr. Laza Lazarević, Belgrade, Ms. Janka Zalešakova, Vice President of the European SPAS Association, Mr. Thierry Dubois, President of the European SPAS Association. Moderator is Ms. Ranitović.
Yes, it's a session about mental health. We heard Mike and his presentation, and I think it's like an excellent introduction to the topic. Sada bih nastavila na srpskom zbog doktorke Irene Đorđević. Znači, naš prvi govornik u ovoj sesiji je doktorka Irena Đorđević. Ona je specijalista psihijatrije. Zaposlena je na klinici za psihijatrijske bolesti dr. Laza Lazarević u Beogradu i sertifikovani je psihoterapeut iz oblasti transakcione analize i gostujući predavač na edukaciji iz transakcione analize u TA centru u Beogradu. Već 2 godine smo u doba pandemije i naši životi su se drastično promenili, naš način života se promenio. Ovde govorimo o zdravim ljudima i svi osjećamo posledice tog produženog stresa, da, možda bi to mogli nazvati posttraumatskim stresom, zbog svega što smo doživeli, zbog straha, zbog neizvesnosti. Samo da pomenem neka negativna osjećanja, znači briga, usamljenost, a osim toga smo bili fizički neaktivni. Dakle, kako sačuvati mentalno zdravlje u doba pandemije, o tome će nam reći vaša prezentacija. Izvolite.
Dobar dan i hvala na pozivu. Veliko mi je zadovoljstvo što sam danas ovde i što sam u prilici da govorim o jednoj ovako važnoj temi, a to je zaštita mentalnog zdravlja u doba pandemije. Dakle, malo pre smo čuli jedno divno predavanje koje između ostalog spominjene su i emocije. I upravo tako, emocije su uglavnom reakcija, naravno, na ono što nas okružuje i ono što je jako važno, to je da svaka emocija ima tačno svoju funkciju. Kada je u pitanju doba krize, kao što je sada u doba pandemije, pre svega ono što se nekako prvo navede jeste ta emocija straha. Strah od toga da ćemo se zaraziti, strah od toga da ćemo umreti, ukoliko bismo se zarazili, strah da ne zarazimo bližnje, koji je bio vrlo, vrlo izražen u ovom periodu od početka pandemije. I naravno, to strah zapravo predstavlja jedan pokretač. Pokretač, kada god imamo krizu, zapravo kriza nam služi da negde unapredimo sopstvene kapacitete, da se adaptiramo, da postanemo savršenija verzija praktično sebe i da se prilagodimo na te novonastale okolnosti. Prilikom ove krize, naravno, ono što je bilo posebno izazovno jeste adaptirati se na izolaciju, na ekonomsku neizvesnost, na rad od kuće koje je često podrazumevao, naravno, paralelno rad i čuvanje dece, često i gubitak posla, naravno. Ono što je bilo ključno nekako u čitavom ovom periodu jeste da se obezbedi taj doživljaj predvidljivosti. Kao i kod dece i kod nas odraslih, negde ta predvidljivost u stvari nudi jedan doživljaj bezbednosti, zapravo sigurnosti. I svi mi imamo visok kapacitet za adaptaciju. Zato je bilo jako važno, naravno, angažovati te kapacitete, prilagoditi se u maksimalnoj mogućoj meri u skladu opet sa onim koliko nam je to dostupno. Međutim, postavlja se pitanje šta se dešava onda kada se iscrpe ti kapaciteti za adaptaciju, a činjenica da je sve ovo izuzetno dugo trajalo i da, naravno, traje i dalje, a da je pritom sve vreme neizvesno koliko će zapravo trajati, dodatno je, naravno, iscrpljivalo te kapacitete za adaptaciju. I onda se postavlja pitanje šta se dešava sa onim ljudima čiji su kapaciteti za adaptaciju negde iscrpljeni. Ono što negde statistika, ona koja je sada dostupna, kaže, recimo u Nemačkoj su procenjili da je čak 40% povećana potreba za psihoterapijom u protekle 2 godine. Posebno su deca ugrožena. UNICEF upozorava u tom smislu zato što pre svega se negde narušila njihova rutina. To je ono što je prvi problem. Oni nisu pohađali nastavu, nisu se družili, manje su se bavili fizičkim aktivnostima i naravno sve češće oni kažu da se osjećaju ljuto, da se osjećaju bezvoljno, sve intenzivnije su još kod njih, naravno posebno u adolescenciji, različiti poremećaji. Ono što je ključno u ovom periodu krize i uopšte u bilo kojoj krizi jeste uspostaviti neke nove rutine. Te rutine nam u stvari obezbeđuju taj doživljaj predvidljivosti, odnosno sigurnosti. Porodica je takođe posebno u krizi. Ono što se uočava jeste porast porodičnog nasilja, takođe povećan broj zahteva za razvod braka. Sad, ono što se postavlja kao pitanje je šta se dešava sa ljudima koji su iscrpili sopstvene kapacitete za adaptaciju. Tu možemo da kažemo da posebno su osetljive grupe ljudi koji su skloni anksioznim poremećajima i sa stresom povezanim poremećajima. Pa sad tu imamo panični poremećaj, agorafobiju. Zapravo, kod agorafobije se često dešava da su ljudi imali panični poremećaj, onda počeli da izbegavaju mesta gde bi potencijalno moglo da im se dogodi ponovo panični poremećaj, pa onda se dešava da imaju problem da izađu iz kuće ili da imaju problem da ostanu u kući bez pratioca. Imamo sve češće generalizovani anksiozni poremećaj. To je bilo ono strašljivo iščekivanje, stalno iščekivanje nekih neprijatnih vesti, kao da smo stalno upitani ono šta ako se ovo desi, šta ako se ono dogodi i tako dalje. Takođe, česte su somatizacioni poremećaji, pa onda se dešava da ljudi zapravo ispituju brojne poremećaje koje bi potencijalno mogli imati, praktično ispitaju sve moguće sisteme organa, da bi na kraju u stvari utvrdili da je to psihogenog porekla. Takođe, specifične fobije, sa stresom povezani poremećaji i naravno i neko može da reaguje i psihotičnom dekompenzacijom, zapravo to bi bilo jedno otuđenje od realiteta. Ovo govorimo o ljudima koji imaju predispoziciju da u situacijama kada im se dogodi neki veliki stres, kada su u periodu intenzivne krize, u stvari dođe do nekog dodatnog intenzivnijeg poremećaja. U ovom periodu prethodnom, ono što smo posebno imali priliku da vidimo jeste negde naglašavale su se kod ljudi te prisilne misli o tome da mogu da zaraze svoje bližnje i brojni rituali koji su oni sprovodili da se do toga ne dođe, a onda se dešavalo da su u stvari sebe izolovali i više nego što je to bilo nužno i da su značajno sebi uskratili i socijalne kontakte i što ih je opet uvelo u neko stanje dodatne depresivnosti. Postavlja se pitanje da li je u stvari ovo doba pandemije ujedno i doba, odnosno pandemije korone, ujedno i doba pandemije depresije. Ja ću samo kratko predstaviti sada šta to podrazumeva blaga depresija, klinička slika blage depresije i verujem da ćemo ovde svi da se prepoznamo, da smo u nekom trenutku sigurno imali ovu kliničku sliku, ako ne i sad. Ono što je sporno kod blage depresije jeste to što je čovek u stvari funkcionalan, on završava posao i zbog toga blaga depresija ostaje neprepoznata. Međutim, naravno, to što ostaje neprepoznata, to podrazumeva da ljudi ne traže pomoć, da ne štite sebe adekvatno i samim tim dolazi i do komplikacija nakon toga. U kliničkoj slici blage depresije, ono što ćemo prvo da primetimo jeste jedan pad koncentracije, pad volje, sve manje uživanja, sve manje toga što nam neko donosi uživanje, san koji nije okrepljujuć i naravno onda dolazi i do jednog pada raspoloženja, pa kažemo depresivan sam, nešto sam neraspoložen danima, nije mi ni do čega, sve mi je svejedno prilično. I kao što rekoh, ono što je osnovni problem kod blage depresije jeste što ostaje neprepoznato, ljudi jednostavno nastavljaju dalje da funkcionišu i obavljaju svoje poslove, ali negde ne zadovoljavaju ono što je nekako potreba njihove duše i ne traže adekvatnu pomoć za sebe. Zato je važno da se na vreme primete simptomi, da se zaštitimo, da zatražimo pomoć, da učinimo nešto dobro za sebe. Kada su u pitanju ljudi koji već imaju određeni problem, ja prosto moram da napomenem ovo i važno je da je klinika Laza Lazarević u saradnji sa Ministarstvom zdravlja Republike Srbije osnovala prvu nacionalnu liniju za prevenciju i pomoć ljudima koji imaju više vrsta problema, pa tako u opciji 1 imamo, to je nacionalna linija za prevenciju suicida, za sve ljude koji imaju suicidne ideje, namere, oni mogu vrlo jednostavno da pozovu ovu liniju i da tamo prosto imaju podršku ljudi koji su obučeni za to, ljudi koji su stručnjaci. Uskoro će biti dostupna čak i aplikacija, tako će biti to moguće jedno brzo biranje preko mobilnog telefona. Takođe u opciji 2 imamo pomoć uopšte ljudima u toku pandemije, znači za sve ovo što sam prethodno navela kada se pojave strahovi, bilo kakvi psihički simptomi u toku pandemije, to bi bila ova opcija. Takođe imamo opciju 3, to je za pomoć adolescentima i opciju 4 za pomoć ženama u peripartalnom periodu. Sad se postavlja pitanje šta je to što mi svi možemo da uradimo za sebe, nekako sada da govorimo onako o svima nama. Ono što bi bilo izuzetno važno u doba pandemije, prvo jeste ograničiti priliv informacija. Mislim da je to nekako prvo što je potrebno uraditi, tačno selektovati izvore informacija koji su nam adekvatni i na takav način sebe zaštititi stalnog bombardovanje raznim informacijama koje su po pravilu neprijatne i tog stalnog iščekivanja nečeg još neprijatnijeg. Važno je uspostaviti nove rutine. To nam zapravo daje taj doživljaj negde predvidljivosti, a to u stvari znači sigurnost. Naravno, izuzetno je važno da se okružimo ljudima, da komuniciramo, da negujemo bliskost na neki sebi svojstven način i opet bez obzira što nam možda neki načini okupljanja nisu dostupni kao ranije. Važno je naučiti da budemo u sadašnjem trenutku. I to je ono što je priča koja je malo pre pokrenuta i meni izuzetno drago. Mislim da je to jako važno. Zašto je važno da budemo u sadašnjem trenutku? Važno je baš zbog toga što neke emocije koje imamo nisu adekvatne ukoliko su u prošlosti ili ukoliko su vezane za budućnost, ali su sasvim adekvatne ukoliko su u sadašnjosti i one označavaju nešto i one nas pokreću na neku promenu. To je ono što je jako dobro. Kako da budemo u sadašnjem trenutku? Kako da sebi pomognemo da više budemo u sadašnjem trenutku? Pa to je svakako prvo fizičkom aktivnošću. Naravno, bilo bi važno da naučimo neke tehnike opuštanja, ono što je ono što mu je nekako, ono što je nekde njemu svojstveno, ono što je njemu prihvatljivo, ono što mu prija. Izuzetno je važno, naravno, da imamo mogućnost da se ponekad izmestimo iz svog uobičajenog okruženja u neko okruženje koje nam omogućava da imamo mir, spokoj, da budemo u kontaktu sa sobom i da nekako što više budemo u sadašnjem trenutku. Onda zapravo nastupa ova današnja divna priča o wellnessu, o wellness industriji, uopšte svim programima koje ćete verovatno tek predstavljati. Hvala najlepše.
Hvala Irena, thank you. If you have any questions for Irena, I ask you to prepare them for the end of the session. Na kraju, Irena.
Okay.
Our next speaker, and actually keynote speaker, is Janka Zalašakova, President of the Slovak Spa Association and Vice President of the European Spa Association.
Hello.
Hello, Janka. Good morning.
Ladies and gentlemen, I am very happy. Good morning.
Hello, Janka. Welcome.
Ladies and gentlemen, I am really very happy be with you in this session, mental health, because mental health is more and more important problem of modern humans. I will talk with you about, next slide please, I will talk with you about the burnout syndrome. And this term is relatively new. In the year 1974 was used by Herbert Freudenberger in his monography, Burnout, the High Cost of High Achievement. It is very well turned. One sentence from this book: if you feel exhausted, start to hate your job, and begin to feel less capable at work, you are showing signs of burnout. The stress that contributes the burnout can come not only from your job, but stress from your own lifestyle, and your communication can add to this stress. And also we are very different, we have very different personality, but some of us are perfectionists, some of us pessimists, can contribute as well. In international classification of disease has now burnout syndrome code, special code Z73.0. Next slide, please. Of course, we know about risk factors of burnout. The main risk factors I have in this slide, it is, of course, time pressure, because we know that many people nowadays have not one job, but maybe 2, 3 jobs. And then, of course, they are under time pressure. Then there is also lack of communication, not only in your work space, but also in your private life. Then in workplace, lack of clarity of your duties, unfair treatment between colleagues and managers. This everything is a stress factor and are risk factors of your burnout. Next slide, please. When we start talking about risk profession, which are more in risk of burnout, it was before focused for managers and teachers. But nowadays, in era of pandemic, it is more and more the main problem of health workers, medical doctors, nurses, and others. And of course, the professions which are linked with lifeguards. Next slide, please. Main symptoms, you see it here, it is good known, but all these symptoms which are linked with mental health can also be, can lead also for somatic health problems. It is also very necessary to know. Next slide, please. And what is the place of medical spas or wellness spas with medical background? What are benefits of spa resorts? All our spas in Europe are linked with therapeutical methods of medical specialization, physiatry, and rehabilitation medicine, and of course, balneology and balneotherapy is included in this. We have in one place a team of health professionals, medical doctors, specialists, psychologists, psychotherapists, sport trainers, nutritherapists, ergotherapists, masseurs, etc. They are in one team in spa. What is very important for our clients, patients, that they have the possibility to change of environment. They must come not ambulatory, not for 1 to 3 days, but if the prevention therapy will be effective, they must stay 10 days, 2 weeks. It depends on the problems. We offer stress management through the psychotherapy, then through the autogens training, yoga. And I want to stress also the order therapy. If we come back to Kneipp's concept of holistic therapy, the order therapy is very important part. It means to have order between stress, duties, and relaxing time to this. All maximalisms or in duties or too much relax, too lack of social contacts, the boss are the problem. Then we offer physical activities, not only fitness rooms, but we offer physical activities that can make fun to our clients. We include sleep management, healthy eating. It is a standard in each spa in Europe. And what is very important nowadays is education, not only in a healthy lifestyle, but also in education in psychohygiene. What is added value? Friendly social life in spa places and high quality of nature environment, which is human-friendly location. Next slide, please. I can assume in the end of my short presentation that burnout syndrome, which is a consequence of the modern lifestyle, will be in nearly future a serious problem, and not only for healthcare system. Preventive and therapeutical programs in medical spas can already be the most effective tool to mitigate negative impact of burnout syndrome to whole society. And what I can say that mostly spas in Europe are prepared to offer this program or as a preventive program or as a really therapeutical program in our spas. We start now to put this burnout syndrome to the list of diagnoses, and now we are working on idea to be supported by insurance companies in Slovakia, as it is made by our preventive program, obesity and School of Spine. Next slide, please. You have here in this slide some sources and professional literature to this topic. And my last slide, please. I want to say you good luck, stay healthy. Thank you for your attention, and please, all of you, remember also for order in your own life. Bye.
Thank you, Janka. And thank you for your time, because I know that your schedule is very busy today. And thank you very much. Could I ask you a question?
Yes.
We started at the beginning talking about wellness as self-care and means of self-care. So when we talk about mental health and burnout syndrome as well, could you give us some advice? How do we care about self just to prevent burnout syndrome?
Yes, of course. When you are in the stage that you have the signs of burnout syndrome, very often it is impossible for you to do it yourself to prevent. Then you must contact somebody who can help you, because you must prepare a list of your duties and you must look, and it is necessary for me, this. And I want to say that also I must sometimes sit down and look for all my duties and say, no, it is is not necessary. This one is not necessary because I think that I am personally a professionalist and I need to make a good job and to have results, and then it is impossible to have too much duties in your life. And you must also think also for your relatives to be also free for them. It is also very important. But sometimes you need help, and medical spas and our professionals in medical spas can help. Come to the spa maybe for 1 week with this problem, and I am sure that after 1 week you make.
We had some technical problems, but yes, we understood well what you're telling us. It's a matter of priorities, of course, in our lives, to make priorities, not overburden ourselves, to be overwhelmed, and of course to ask for help if we need it. And of course that the thermal spas are offering us everything we needed actually for that, for healing and to recovering. Am I right?
Yes, you are right.
Thank you very much, Janka. Thank you for your presentation. We'll see you later.
And see you in the afternoon.
Yes, see you in the afternoon. Our next speaker will be the president of the European Spas Association, Mr. Thierry Dubois, and his team, his brother Olivier. They will share with us the long tradition and experience at Thermes Surgeon in France, which is specialized for mental health spa treatments and updates in the post-corona era. We'll watch a pre-recorded presentation due to health challenges they have there, and we have actually everywhere at the moment.
Natasha, dear attendees, dear members of ESPA, as president of ESPA European Spa Association, but also of CNET, French Spa Association, I am pleased to present the treatment carried out in balneotherapy for psychological disorders in France. As you know, we have in our country a very medicalized approach in our cures for the following reasons. First, the duration of the cure is 3 weeks, which allows the medical team to carry out a treatment adapted to the different pathologies treated. Second, the cost of the treatment is covered by the National Health Insurance Fund in exchange for good quality medical care. The patients are followed up with 3 consultations during the cure. There are 5 spa towns in France specialized in medical health problems. Sojon is currently the leader in this field and treats these medical problems exclusively with the help of psychiatrists who are highly experienced in these pathologies. It is a company that has been in our family for over 160 years. After 39 years at the helm, I am now the chairman of the supervisory board, and Dr. Olivier Dubois, my brother and a psychiatrist, is the CEO. He has carried out several studies published in international scientific journals, and I give him the floor so that he can explain to you the treatment carried out at Sojon for the patients who come for various psychological pathologies. Olivier, the floor is yours.
Hello, I thank the organizers of ESPA for their invitation. While there is ample evidence that COVID-19 has broad consequences on mental health, with, according to numerous surveys, a rate of chronic anxiety and depression that has almost doubled, even tripled. among youth between the ages of 18 and 25, and a rate of suicidal acts in the emergency services, which has increased by 30% for adults and by 50% for young people in France. The question of the management of these disorders can indeed find a large answer in certain spa resorts specialized in mental health and psychiatry. Among these chronic pathological reactions, most of them consist of anxiety disorders, depression reaction, or post-traumatic syndromes. We regularly encounter long COVID, which appear to be in reality chronic anxiety states with often a reactive depression scale. By way of introduction, I would like to make two remarks. The first is that the first-line doctors, as well as the doctor specialist, if they know well the ambulatory medicine, drugs and psychotherapy, and the hospitalization, know only very little the spa resort medicine as practiced in France, with 3 weeks of balneotherapy and medicalization taken in charge by the health insurance in France. The second one is that this complementary medicine finds indisputable indication in mental health, notably in this interminable crisis of the COVID. We missed recent data on the effect of balneotherapy in spa resort on anxiety disorder to COVID, but we have data on the effectiveness of the 3-week spa resort on pathologies related to mental health. This is what I will try to present them here. Stop-Tie study has been published in 2010. This study on 247 patients with generalized anxiety disorder living near one of the 4 French centers specialized in mental health. These patients were randomly selected either in the paroxetine group during 8 weeks, reference treatment for generalized anxiety disorder in the world, or in the immediate French spa treatment during 3 weeks. The main time of evaluation was at 8 weeks, then the 2 groups crossed their treatment. After 2 months of treatment, a clearly significant difference was observed for patients in the balneotherapy group versus those in the paroxetine group. 44% difference in favor of the balneotherapy group was obtained. We note that the therapeutic effect was significantly reinforced between the end of week 4 and the end of week 8, as can we see in the figure below. In red, the evolution with balneotherapy, and in yellow, the evolution with paroxetine. If we take into account the patient considered as cured, less than 7 points in the HANA scale, we can see that in the group balneotherapy, nearly 25% are cured, whereas only 7% were cured in the paroxetine group. This is probably the most spectacular information, the number of patients cured at 2 months. Patients improved by at least 30% at 2 months in the balneotherapy group were followed for 6 months. The information is based by the fact that 30% of patients were lost to follow-up However, for 70% of patients, the overall improvement at 6 months is still 49% for responders. This study was published in the US review Complementary Therapies in Medicine. One part of top-tier study looked at the effect of balneotherapy on depression. Of the 237 patients followed, 57 had an associated depressive state, 26 in the treatment group by balneotherapy and 31 in the paroxetine group. The improvement of the depressive state in the balneotherapy group was significant at 8 weeks comparatively at paroxetine group. Now we constate the effect of balneotherapy on fibromyalgia. Everyone knows the strong correlation between fibromyalgia and anxiety and depressive disorders or sleep disorders. Several international studies on psychosomatic disorders have shown on secondary criteria the effectiveness of balneotherapy in the psychological symptoms of fibromyalgia. In particular, the Italian study realized by Balometti, which showed a significant reduction in depressive symptoms in the group treated with balneotherapy on 100 patients. This meta-analysis confirmed this result. Now we present a study was carried out in 213 patients to obtain the cessation of the consumption of anxiolytic and hypnotics in patients who were chronic consumers more than 6 months and motivated to stop using these drugs. 70 patients were recruited. Benzodiazepine cessation was considered as the cessation obtained before the end of the 3rd month and maintained at the end of the 6th month. %41% of patients who followed the 6-month protocol completely stopped their drug use at 3 months, confirmed at 6 months. This is a very good result for this experience. In total, the equivalent of 75% of the initial consumption was reduced at 6 months. We can see that the reduction was more spectacular for anxiolytics, nearly 80%, than for hypnotics, only 68%. Clinical evaluation of the 70 patients was provided for 6 months around 2 scales: HID, Hospital Anxiety and Depressive Scale, and Beck Depression Scale. The 41% of the patients who had completely stopped their benzodiazepine were compared with the 58% who had only reduced them. There were 2 interesting findings. The first is the stop benzodiazepine group was initially significantly more anxious and depressed than other group. The second one is that the stop benzodiazepine group at 6 months, despite the fact that they had stopped their treatment, became significantly more improved clinically as well on the criteria of anxiety and the criteria of depression. Thus, this study demonstrates several elements. The capacity of the SPA therapy and the SPECT protocol to allow the cessation of chronically prescribed benzodiazepine even when the anxiety depressive state is important. And secondary, the fact that the cessation of consumption is accompanied by a spectacular clinical improvement. This study was published in an international review, Evidence-Based Complementary and Alternative Medicine. In conclusion, the balneotherapy used in spa resort in mental health are essentially indicated in depression, in anxiety disorder, and all the collateral pathology. Burnout, benzodiazepine withdrawal, avoiding depressive decompensation. Therapeutic model of balneotherapy in spa resort is specified because there is an institutional model during 3 weeks with competent and dedicated staff, intermediate between outpatient and inpatient with hospitalization, and interest in practicing cognitive and behavioral therapy, other therapies, and psychoeducation in addition to balneotherapy treatment. In the end, the objectives of balneotherapy in spa resort are multiple: prevention, knowledge, care, with the help of institutional therapy, medicalized therapy, biological therapy, social therapy, psychological therapy, and environmental therapy. I thank you very much for your attention. Goodbye.
I think it's very, very useful presentation that we found out more about proofs, about actual evidences of effectiveness of the thermal spa cure, and it's really good to know, and it's a really good example for other spas which could actually implement some programs combining with thermal spa based on these evidences. And there is, just to underline some facts, there are significant positive effects of 3 weeks balneotherapy treatments. Yes, we need research-based evidences on effectiveness of balneotherapy. Clinical studies in France proved that spa treatments are effective in the reduction of anxiety, depression, sleep disorder, and burnout syndromes, and reduction of medication. What is needed for effective treatments of mental disorders? Integrative approach, prevention, education, medication, spa treatments, social, psychological treatments, so on. So it's a really good example, and we heard another one, a good example from Slovakia. So at the end of this session, I would like to thank you to all of speakers, and I think that we cover at the beginning of the forum, we cover mental health, mental wellness challenges we are facing in pandemic, prevention, how to prevent what we could do for ourselves, and if we need help, then to be aware of that, to try to and to reach specialists. It's something which is normal during pandemic and after pandemic as well. At the end, I would like to ask you, Irena, izvinjavam se. Kad govorimo o mentalnom zdravlju, jako je važno ono što možemo i za sebe da uradimo u svakodnevnom životu pre nego što se vama obratimo za pomoć. U osnovi tog pristupa brige o sebi je i koncept ljubavi za sebe. Ukoliko nemamo ljubavi za sebe, bar u onoj meri ukoliko imamo za naše drage i ljude koje volimo, jer za njih smo puni razumevanja i nikad ih ne kritikujemo, za razliku od nas samih. Ukoliko te ljubavi za sebe nemamo, to je taj poznati koncept self-love koji se različito tumači, nekada se tumači kao sebičnost. Da li možete malo to da prokomentarišete i da nam približite taj koncept, da prosto nemamo možda nepotreban otpor prema tom nečemu, znači prema tom konceptu koji nam zapravo može biti koristan u našem svakodnevnom životu, da ne dođemo do toga da iskoristimo onaj kapacitet, kako ste vi rekli, za prilagođavanje. Tako je, da.
Upravo tako. Taj koncept možda nije nužno da ga tako zovemo, ali je svakako ono što je u osnovi nešto što je važno, a to jeste zapravo voleti i negovati sebe. Zašto bi to bilo važno? Prvo, ako posmatramo uopšte kako se razvija ličnost, onda možemo prvo da krenemo od toga da u stvari mi negde ideju o sopstvenom, o nekom scenariju sopstvenog života dobijamo na uzrastu kada smo vrlo mali, u suštini negde se ličnost formira u prvih nekoliko godina života, kada mi još uvek nemamo ni dovoljno dovoljno bogat rečnik, ni moć apstraktnog mišljenja da bismo mogli da razumemo stvari koje nas okružuju i uopšte pojave koje nas okružuju i poruke koje dobijamo od roditelja i od nama važnih drugih ljudi. U tom periodu mi u stvari zaključujemo mi u stvari tada donosimo odluke kako ćemo se nadalje ophoditi prema sebi. Često to bude surovo i mi često još od tada krenemo sa idejom da nismo dovoljno vredni i važni sami po sebi i postanemo u stvari surovi prema sebi. Često sa takvim konceptom, kada idemo kroz život, imamo imperative da bismo onda bili dovoljni, jer onda moramo raditi sve savršeno ili moramo stalno ugađati drugima. To su sad razni imperativi, moramo biti jaki, ne smemo pokazivati emocije i sve tako dalje. To su razni imperativi koji nas kasnije vode kroz život i negde nam zapravo dok ih ispunjavamo, mi se u stvari osjećamo da ipak jesmo vredni i važni. Međutim, to iscrpljuje naše resurse izuzetno i mi u stvari ne možemo ni biti adekvatni prema drugima ukoliko u nekom momentu ne shvatimo i ne počnemo da radimo na tome da zapravo prvo prihvatimo i zavolimo sebe onakvi kakvi jesmo. Jer i kada smo tako prema sebi kritikujući, ne možemo biti realni ni adekvatni ni za druge ljude i u krajnjoj liniji ne možemo biti u tom sadašnjem trenutku u kom toliko pričamo. U stvari to jeste ključno. Zašto sadašnji trenutak? Zašto nam je to uopšte toliko važno? Često postupamo zato što smo navikli da tako postupamo. Oduvek sam tako reagovao, kažu ljudi, pa sad je valjda opravdano da i sada ponovo tako reagujem. A zapravo je nekako lični razvoj ono što treba da se umeđu vremenu dešava i da mi zapravo autentično reagujemo u skladu sa sadašnjom situacijom, a ne da reagujemo burno, recimo u kontaktu sa nekim novim, zato što su nas do sada ljudi, kako mi kažemo, povređivali. Zapravo nisu nas ljudi povređivali, nego ideje o tome, naši doživljaj tog odnosa, to nas je povređivalo uvek, naš doživljaj, naša ideja, naše uverenje u stvari to koje može da izazove određenu emociju. I važno je takođe da kažem da su određene emocije potpuno u redu, recimo ljutnja, potpuno u redu da je osjećamo u sadašnjosti. To je emocija koja nas navodi na promenu i to je emocija koja u stvari zahteva da se mi menjamo, adaptiramo ili da tražimo promenu od drugih ljudi, ali ako je ljutnja koja se odnosi na prošlost, ona je onda neadekvatna ljutnja. Onda govorimo zapravo o tom sadašnjem trenutku i o važnosti toga.
Hvala. For the end, just tell me, what is your definition of meaningful life?
Okay, I'll answer that, but I would just also quickly like to talk about living in the moment. There was another thing I wanted to add about that, and that is, if you resist the moment that you are in, if you fight against it, you suffer. So it's going back to what I was saying about the Greeks and the Stoics accepting the moment that you're in. And the writer, Maya Angelou, says something very interesting. If you don't like something, change it or change how you think about it. So that's the moment. Leading a meaningful life, putting 100% into what you're doing. And concentrate in your life on those things that you love to do. And finally, it's not what you achieve. You can have all the luxury holidays, the BMW, the beautiful house, the plasma television. It's not what you achieve in life. It's who you become as a person. And when you look at the mirror at night, who you see in the mirror. And finally, the writer Maya Angelou says something very, very simple and very clear. In life, just do what is right, and not always easy. Thank you very much.
Thank you.